Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Dear viewers, a warm welcome to all of you to our show, Doctor's Voice. Now we are in Singapore, giving you a wonderful view of beautiful Singapore. And of course, we shall talk on beautiful life. How you will get a beautiful life? To keep away cancer. Yes, viewers, today we will talk on cancer, especially on lung cancer. Today we have Dr. Liang with us. Dr. Hong is a senior medical oncologist with more than 25 years of experience of working with several cancer institutes, home and abroad. In addition to general medical oncology, being a scholar, He has a special interest in lung cancer and head and neck cancer. He is also trained in high-dose chemotherapy and bone marrow transplant. Dr. Lim is a fellow of Academy of Medicine and a member of American Society of Clinical Oncology and International Association for Study of Lung Cancer. He is also a member of the Singapore Cancer Registry Advisory Committee, and he is the senior consultant at Parkway Cancer Center. Welcome, Doctor. Welcome to our show.
Thank you very much for the kind introduction.
Thank you.
Thank you very much.
All of us know about cancer. We know about the side effects of smoking and air pollution. Would you please highlight on the lung cancer and especially how the air pollution or environmental pollution, especially smoking, affects on lung?
I think all of us are aware that lung cancer is closely associated with cigarette smoking. You see, worldwide, with 100 lung cancer patients, about 80 to 85 lung cancer patients would be smokers. So lung cancer is closely associated with smoking. Okay, but there are other causes of smoking, other causes of cancers, but those are minority cases. Passive smoking is also the cause of cancer, but the effect of passive smokers is much less than active smoking.
Would you please explain the passive smoking? That means I'm not smoking, but getting the...
Okay, passive smokers is people who inhale the cigarette smoke for the nearby smokers. They are not smoking themselves, but because the neighboring people are smoking, they inhale the exhaled smoke of cigarettes. We know that if you are active smokers, the chance of having the lung cancer is about 10 to 15 times that of the never smokers. But if you are passive smokers, that means you do not smoke, but you inhale the cigarette smoke, your risk of cancer is about 1.5 times. It's not that big, but still significant. So our recommendation is, if you are smokers, please stop and try to avoid passive smoking.
Yeah. Especially in our country, or maybe in the Southeast region, in your country also, ladies are less a smoker. So they are the passive smokers. And do the this smoking, passive smoking also affects the fetus if in case of pregnant woman?
Okay, so I think smoking affects the fetus in many ways. But one of them will be like in terms of the maturity, the preterm labors, and retarded growth in the uterus. So we always say that for any women who are pregnant, please avoid smoking.
Of course, and also ask her husband or others around her to stop smoking. Is there any specific particles in the air or in the environment which can cause the lung cancer? That's why we always say the polluted air causes us lung cancer.
Okay, it is very difficult to prove that environment pollution can increase the risk of lung cancers because you cannot compare a person who live, you cannot compare two cities with two different pollution. But now we have fairly good epidemiological data to say that actually pollution in the environment, smoke, haze, can increase the lung cancer risk. But the risk increment is much less than cigarette smoking. It can increase the risk by 1.5 times, which is about the same as passive smoking.
Okay. Is there any specific type of occupation which can cause cancer, especially lung cancer, or act as a risk factor? Any occupation?
I think the
like
most
coal mining or something.
I think the most well documented and the highest risk will be workers that are exposed to asbestos. These are material usually used in the older time in insulation. So yeah, the building workers will use the ceiling board using asbestos, or like sometimes they are used in the older days like brake linings for the cars. So these workers has a very high risk of getting lung cancers. But other less risk are, you're right, coal mine workers. A group of people that has increased lung cancers will be those using wood or coal fire for their heating indoors. So they stay indoors at winter. So the smoke from this heating is kept in the room and they inhale it. And those patients are at fairly high risk of getting lung cancer as well.
It's a very important thing. Not only smoking, there are so many risk factors for lung cancer also. Now come to the point of the treatment, and before that treatment, the diagnosis. What are the ways of diagnosing the lung cancer or the medical advancements nowadays?
Usually, well, only patients with symptoms will go and see a doctor. For example, lung cancers, the usual symptoms are cough, unexplained cough, which is prolonged, more than 2, 3, 4 weeks. Sometimes they can present with blood in the sputum, you cough out blood, and sometimes there's unexplained weight loss or chest pain. The problem with lung cancer is, at the time of diagnosis, it is usually at the advanced stage. Because you have the big lung with the small tumors, they do not cause symptoms. And that is why, if 100 lung cancer patients newly diagnosed, only 10 to 20% of all lung cancer patients are diagnosed in stage 1 and 2, the early stage, where cure is possible by surgery. So the majority will be stage 3 and stage 4, where the outlook of treatment is very poor. And because of this, a lot of people have been looking at, is there any way we can screen or diagnose lung cancer at the early stage when they're asymptomatic? For example, we can do mammogram for breast cancers, we can do a PET smear for cervix cancer. Chest X-ray has been tested for a long time, for many years, to see whether a routine yearly chest X-ray can actually reduce the chance of dying from lung cancer by picking it up early. Unfortunately, thousands of patients have been trialed and we find that a routine screening chest X-ray is unable to pick up lung cancer early stage to reduce the risk of lung cancer death. Recently, the CT scan is commonly used. CT scan of the chest. Being a CT scan, we can pick up the lung lesion at a much earlier stage. The good news is about 2-3 years ago, there's American studies which prove that screening CT scan yearly for 3 years in patients who are otherwise healthy, but they are smokers and they are at a higher risk of lung cancer, can actually pick up the lung cancers earlier and reduce the rate of dying from lung cancer in the screen group. So at least in America, CT scan screening has been recommended for anyone who had a high risk of getting lung cancers, which is defined in the population as above 55-year-old who have smoked at least 30 pack years. 30 pack years, and each pack year is defined as if you smoke 1 packet of cigarette a day for 1 year.
Each packet contains 10 sticks
20
like that.
sticks.
Okay.
If you smoke 1 packet a year for 30 years, we call it 30 pack years. If you smoke 2 packets a day for 15 years, we also say 30 pack years. So at least in America, people have starting to recommend low-dose CT scan without contrast as a screen for lung cancers. The problem is this recommendation is not widely accepted because there are lots of problems with CT scan screening. In the study, they screen anyone yearly for 3 years. But what is going to happen after 3 years? Do you keep screening every year? You go for CT scan for 3 years, 5 years, 10 years? And in that studies, a lot of patients have abnormality on the CT scan, which may or may not be lung cancers. So a lot of patients pick up with abnormality, and additional tests needs to be done to confirm lung cancers or to confirm it is not lung cancers. So because of this, I don't think we can make a general recommendation for CT scan for all patients above certain age group, above certain risk group to have CT scan screening. But I think any patients who come to my clinic and say, oh, I want to screen for lung cancers, I think CT scan screening will be the way to go. But before doing that, you probably have to discuss with patients the pros and cons of the CT scan, the possibility of picking up some abnormality that is not lung cancers, and you end up doing additional tests. And so after that, after making that discussion, then we can make a recommendation.
And so it's very difficult from both sides, from the patient and also the physician or the person who is going to.
So I think,
with your kind permission, we are going to take a very short break. Can we?
Thank you.
Dear viewers, we are going to take a very short break. Don't go away.
The fight against cancer is often a story of hope. With hope, patients and their families have an easier time coping with cancer. And hope helps them focus on the recovery process. Parkway Cancer Center has a multidisciplinary team of medical specialists, all dedicated to meeting the specific needs of cancer patients. At PCC, we use the latest technologies in cancer treatment, so patients can access proven, innovative therapies for the best clinical outcomes. We're committed to providing the most comprehensive holistic treatment for our patients. But more than that, we're their partners too, in their journey of hope. PCC, Singapore's leading cancer center.
Welcome back to beautiful Singapore, and we are talking on cancer with Dr. Liang. So doctor, we were talking about the diagnosis of lung cancer. Is there any time period when one should consider oneself that I may have cancer regarding the symptoms like cough for a long time or blackish sputum for a long time, like something like that?
Okay, I think as far as cough is concerned, the problem with cough is a very common symptom.
Yes.
If a smoker without cancer, you have cough. If a normal person, healthy person, you have the flu,
Yes.
you can have a cough. If you have asthma, you have a cough. So the cough that makes us worry is a cough it is of excessive duration, at least more than 2-3 weeks, especially if it is not related to any causes, possible causes. If I have a fever, running nose and a sore throat, if I have a cough, I'm not worried. If I'm an 18-year-old with never smokers, have a cough for 2-3 weeks, I'm not too worried. But let's say the cough is associated with additional symptoms that may be due to lung cancers. For example, you're a 60-year-old man who are a heavy smoker who has a cough for 3 to 4 weeks, I get worried. If I have a middle-aged person who had a cough associated with blood-stained sputum, I get worried. If I have a person with a cough that associated with weight loss, I get worried. I get worried not only for lung cancers. I worry about something may be going on, something may be serious. You have a tuberculosis. You can have cough.
That's also very
You have
common.
a blood-stained sputum. You have a weight loss. Then obviously these patients, whether it's tuberculosis or lung cancers, then you need to investigate. So usually cough by itself is very difficult to determine. I'll look for duration, the possible non-cancer causes that are present, I'm not too worried, or other additional symptoms or that make me worried about underlying problem, blood-stained sputum, chest pain, shortness of breath, weight loss, that should not be there.
Is the lung cancer curable?
Okay. The answer is yes and no.
Yes.
Okay, so obviously, let's take a general look. If you have 100 new lung cancer that is diagnosed today, I think about 10 to 15 will be cured. So who are these 10 to 15 lung cancer patients that are cured? They are patients who are diagnosed very early. In stage 1 or 2, they are confined to the lung. They have not spread to organs outside the lung, and they undergo curative resection surgery. For stage 1 and 2 patients that has undergone surgery, the chance of cure is actually anything from 40 to 80%. So if you're early stage lung cancer patient, you can say that the chance of cure is actually quite high. But you're diagnosed a bit later, let's say stage 3, where the tumor is very big, or the tumor still within the lung, but involve the lymph nodes. Treatment will be radiation, but the aim will still be cured, but 10 to 15% will be cured. Where stage 4 is incurable. So whether you are potentially curable or not depends on the stage of diagnosis. That's why for lung cancers, it's very important to diagnose early. And because we do not have a good screening test, we will say that if you have symptoms that you are worried, don't delay.
Yeah,
If you have
of
cough
course.
or fever, don't delay. Don't assume you'll be all right. We also say that if you are the medical worker, if the patient that have symptoms that's suggestive of underlying cancers, don't delay also. Get the chest x-ray done, evaluate, and get the diagnosis early.
So what are the treatments, like from early stage to severe stage, what are the treatments?
Okay, lung cancer is like any other cancers, whereas treatment can be radiotherapy, surgery, or drug treatment. Drug treatments, I think chemotherapy or any tablets. And like a lot of solid organ tumors, breast, colon, lung, they're the same. Early stage is always treated with surgery. And your early stage, you're treated with surgery, you get the best chance of cure. Then you have the middle group, where what we call locally advanced, where the disease is still confined to the lung, but surgery is not possible because the tumor is too near the heart, too near the main airway. Then the treatment will be radiotherapy. And again, radiotherapy, there's chance of cure. And for patients with advanced disease, lung who has spread outside the lung via the bloodstream, we need a treatment that can treat all parts of the body. And that's why drug comes in. You either take the tablets or you give by infusion, and they travel through the bloodstream to all parts of the body to treat all parts of the cancers. So sometimes we combine the treatment. For example, for early stage lung cancer patients, after surgery,
sorry for the interruption. As a physician, you have to choose the specific or the individual treatment option for the individual patient.
Yes.
Not that?
Yeah.
Okay.
So when we see a patient, we have to look at the patients and see what is the stage. Then based on the stage, we'll say that surgery is a treatment of choice. But we also need to look at the patient, say whether they are fit for surgery. What are the risks of the patient for surgery? The problem with lung cancer is that a lot of time they are elderly and they are smokers. So the lung function may not be very good. So they may not be able to tolerate surgery to take up part of the lung. So the alternative to surgery, even for stage 1 to 2 patients, we can consider radiation. Radiation still can cure stage 1 to 2 patients, but the cure rate is lower than surgery. That's why if it's stage 1 and 2, if possible, we always go for surgery. But we know after surgery, some of patients recur. The disease recur. We tell them patients, they're stage 1 early stage. We do a scan, the disease has not spread outside the lung. Nothing in the liver, nothing in the bones. But after one year later, the disease starts appearing in the bone. Why do they appear? Why do they recur? They do so because even at the time of surgery, we say stage 1 has not spread. In fact, in a certain percentage of the patients, there is already tumor cells spread to the bone. But it takes 6 months, 12 months for it to grow to big enough size, and we call it recurrence. So you hear of people like breast cancers, lung cancer patients, after surgery, we recommend chemotherapy. And we call it adjuvant chemotherapy. And the aim of this chemotherapy actually is to try to get rid of all these cancer cells that may have already spread. In a way that will reduce the risk of recurrence. If the patients do not recur, they are cured. So adjuvant chemotherapy after surgery is a way to increase the chance of cure for patients after surgery.
Dear viewers, we are going to take a very short break. Don't go away. Welcome back to beautiful Singapore, and we are talking on cancer with Dr. Lim Hong Liang. How it helps that bone marrow transplantation? Is it fits here or?
Okay. Unfortunately, bone marrow transplant is probably not the treatment appropriate for lung cancers. The bone marrow transplant is usually used for cancers like lymphoma and leukemia.
Blood cell related.
Correct, yeah. So in bone marrow transplant, actually what we do is, one way is we can do bone marrow transplant by harvesting the patient's own bone marrow. We store it. And the reason for doing it is to enable us to give the patient very high dose of chemotherapy. We know that the higher the dose of chemotherapy, the better the chance of clearing the cancers. but chemotherapy has side effects. One of the side effects is actually damaging the patient's own bone marrow, causing the white cells to be very low, increasing the risk of infection, causing the platelets to be very low to increase the risk of bleeding. So in high-dose chemotherapy, what we do is we give patients very high-dose chemotherapy. Let the high-dose chemotherapy kill the cancers. As a side effect, it damages the patient's bone marrow, but it's all right. We harvested the patient's marrow, and after chemotherapy, after the chemotherapy has killed out the cancer cells, we re-infuse patient bone marrow for the marrow to recover. So this is what's called autologous bone marrow transplant, using patient's own bone marrow. Another type of bone marrow transplant is allogenic bone marrow transplant, where the bone marrow is from a donor. We do this for example, for patients with leukemias, where we cannot use the patient's own bone marrow because it contaminates tumor cells. So we give the patient chemotherapy and using somebody else's marrow. So there are different
differences,
types.
Yeah.
But
okay,
both unfortunately not applicable to lung cancers.
Yeah. We are very close to the end. So in short, how can we prevent lung cancer?
Okay, as you know, majority, up to 85% of all lung cancer patients are related or caused by cigarette smoking.
Yes.
So if you can stop smoking in the world today, we can actually reduce the majority of lung cancer patients. The lung cancer patients will reduce dramatically. So the best way to control lung cancers is actually to stop smoking. And also for patients of the general population who has not picked up smoking, I think the best way is don't pick up smoking.
Thank you. So would you like to give a message to our viewers to avoid smoking or to prevent lung cancer?
Yes. Okay. So as we know, lung cancers is majority 85% caused by cigarette smoking. And we also know that by stopping for smokers who stop smoking, the risk of lung cancer can reduce dramatically to near normal. So the best way to reduce the lung cancer burden is actually not to start smoking if you're not a smoker, and to stop smoking straight away if you are currently a smoker.
Thank you, Doctor. Thank you very much for being with us and giving your so valuable time for us. It was really our pleasure. Thank you.
Thank you very much. Thank you very much for having me. Thank you.
Dear viewers, we have talked a lot about lung cancer. Hope you have learned also. So please stop smoking and keep smoking away. Then you will have a beautiful life. So please keep with us and be healthy.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Liang. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital will put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spared no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. We have the best of the best working in this hospital.
The clinic's actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile, and that's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.